Hello listeners, welcome to Views on Health. I must say that I've been able to persuade Dr.Suhashini Ratnatunga to come back on the program this week as well, because having discussed recognizing and management of stress on the program last week, post-program we decided that there's much more to it that can be shared with our listeners, and due to time constraints we were unable to go further into this very vital topic which has impacted on almost everybody's life today, whatever one is doing, and from children to adults, even to the elderly, if they are left by themselves or they have very little to do in the evening of their lives. Sometimes just thinking of things what they can do or can't do, or what they did or didn't do, can lead to stress in certain ways in their own lives. It's so wide that I don't think even within this program one can do justice to this very important health aspect. Health in the sense that it impacts on your mind, and I'm talking as a layperson. The professional will deal with it in a better way, I'm sure. But and once it sits in your mind, it impacts on the rest of your body, if I'm not mistaken, and everybody around you in your day-to-day life. So having said that, by way of my introduction, I think it's time to hand the microphone over to Dr. Suhashini Ratnatunga, consultant psychiatrist, National Hospital Sri Lanka, and lecturer in psychiatry, Faculty of Medicine, University of Colombo, who has come back in the midst of a busy schedule to be with you on the program and to tell you more about stress. Over to you, Doctor.
Thank you, Fatima. I thought it would be important for me to discuss today on how to recognize whether we are stressed, whether you or I, whether there is stress, whether we feel stressed out, and why it is important to recognize whether we are stressed and what we can do about it. So how do I know, how do I recognize that I am stressed? It's a bit of a difficult question to answer, but because it differs from person to person. But we do see some common patterns in patients, and I'll probably introduce what they are, and maybe it might be some guide to you for you to understand whether you're stressed. So some patients come and tell me that, doctor, I feel very irritable, or I get angry easily. Small things which don't used to worry me cause a lot of worry, and I go on worrying about it throughout the day and in the night. I find it difficult to concentrate now. I see lapses in my work. And whatever I do takes a long time because I'm finding it difficult to concentrate on a task. I have problems with my sleep, so sleep is disturbed a lot. I find it difficult to go to sleep. I go to bed, but I'm tossing and turning and I can't initiate sleep, or I get up in the middle of the night 2 or 3 times and I'm rolling in bed, but I can't sleep. Then I have a lot of these aches and pains. My shoulders feel tense, my muscles hurt, I'm drinking a lot of paracetamol, I'm using this balm, that balm, and I feel achy all over my body. Then I also have this heaviness in my chest that is there throughout the day, most of the day, and I have this, and my heart goes pat, 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 or I have this rapid heart rate or heartbeat, which wasn't there earlier. Then I also have this terrible headache that's there on most times of the day. It's like a band going around, this tight band going around my head. Then my tummy gets upset easily. I go to the toilet many times of the day, and I don't enjoy the things I used to enjoy earlier. I'm not interested in sex or things like that. So these are some of the things. Some of you all might be able to recognize these things in yourself. So it's difficult to say who has this, but it's not just one symptom. So we don't say that you're stressed because you have a headache. A lot of people will have a lot of these coming together. And if you have been feeling like this for some time now, and it has been going on for some weeks and months now, and also if this is now having an impact on your life, in the sense, if you're not the happy person you used to be, or you're not the efficient person you used to be, or your family members or your friends, your colleagues are telling you, what's wrong with you, what's up, you seem very much on edge, or you seem very, very tense lately. And if this has been going on for some time, then that is probably an indication that you're suffering from chronic stress. Remember in my last program, I said that there are stress at short term is actually quite useful. It will kind of motivate us to perform well, or to do things which we have been postponing for some time. A good example, if I take myself, when I know that an exam is drawing close, I get stressed, and then that motivates me to, get down and study. So a little bit of stress is actually good, because there is good research to show that a little bit of stress actually has a huge impact on performance. But when stress goes beyond the normal level, or not the normal level, in a sense, goes beyond that threshold where it actually energizes you, when it goes beyond that, and when it is sustained for a long time, then we call that chronic stress. In the sense, stress that is so chronic stress is considered bad for your health, and it is considered bad for your physical health. And there are lots of research evidence that is coming out now that talks about the impact, or how chronic stress can have an effect on your body. So what they have actually shown is that it can affect every part of your body, all parts of your body, and for different people, it can have different effects. So if we take the heart or the cardiovascular system, there is evidence to show that high stress levels going on for a long time can actually have an effect on your cholesterol levels. So it can increase your cholesterol. It can have an effect on your blood pressure. High blood pressure can be as a result of chronic stress. And this chronic stress can make people more prone to develop heart attacks and stroke. So that is the effect chronic stress has on your cardiovascular system, or your heart and circulatory system. Then they have shown the effect it has on one's brain, where it can cause problems with concentration, which we recognized earlier. It can increase other anxiety disorders if you have one, or cause a lot of anxiety. And importantly, earlier I spoke about depression, and how depression can be incapacitating, and how depression can be dangerous to one's health. And so chronic stress can also make a person more prone to develop depression. And also people with chronic stress will have irritable mood, and this can actually go on to destroy relationships and have a very negative impact on one's life. Then the dermatologists talk about the effect stress has on one's skin. People talk about hair loss, or brittle hair, brittle nails, dry skin, acne. People come with bouts of acne when they feel stressed, and thin skin, all as a result of chronic stress. So that's why it's important, if you're conscious about your hair and your skin, then you need to think about whether you're stressed, and then manage it accordingly. Then it can have an impact on digestive system, or the gastrointestinal system. We see students just before the exam lining up in front of the bathroom, wanting to go to the bathroom. That is how acute stress actually has a direct effect on our motility, or gastric motility. But also chronic stress can cause absorption problems, nutrient absorption of various nutrients. Chronic stress can cause constipation, and can cause a lot of bloating, pain and discomfort in the stomach. So those are the effects of stress on the gut. Then stress can also have an impact on our immune system. people who are stressed for a long time with chronic stress will frequently complain of colds, flus, feeling sick, getting sick a lot. That's because stress can have a huge impact on our immune system, and therefore reduce our immunity to various bugs, and this can make us more prone to develop different illnesses, viral, bacterial illnesses. Then also there is good evidence to show the effect stress has on our joints and muscles. It can worsen the inflammation, the inflammatory process of some diseases. It can increase the aches and pains you feel if you have an underlying joint or muscle problem. And also it's definitely recognized to cause muscle tightness. Also, finally, stress can also have an effect on our reproductive system. There are lots of couples who come for treatment for subfertility, and when you actually go into the history and talk to them at length, the couple is under a lot of stress, and once they manage to actually deal with the stress and manage their stress effectively, some of them have actually have had no problems conceiving. So stress, it affects in various ways. Stress can have a definite impact on our libido, but it can also have other micro changes in our reproductive system via increasing certain cortisol-like stress hormones. All this can have an effect on one's fertility. So, Fatima, in summary, what I just discussed was the effects of chronic stress on different organs in our body. So it's important, probably one of the most important take-home messages is that stress will affect every part of our body, almost all the systems in our body. And it for different people, for different patients, it might be one or two systems getting involved. For some people, it might be just one system. For some people, it might be all systems. Therefore, it's important to recognize stress in yourself or in a loved one, so that once we recognize it, we can go to the appropriate people or get the necessary help. And the immediate result is you will feel happier, you will feel more relaxed, and you will be able to enjoy life more. But also, you can also block the negative impact it has on all these systems in our body.
How does one do that?
Okay, so that was, thank you for throwing that question to me. So there are what we call stress management techniques. Stress management techniques are techniques we teach patients, we teach clients, we teach people on how to manage your stress effectively. Because most of the stressors I discussed earlier in my talk was that we actually have very little control of certain stressors. Last time we discussed about natural disasters. Nobody could have predicted this COVID. We have little control over the people at our workplace, our colleagues, our bosses. We have little control over the small things that happen day to day in our life, like bad traffic, house maintenance, house repairs, things like that. Therefore, since we don't have control over these stressors, it is important to develop effective stress management techniques in ourselves, so that when we are faced with the stressor, we have the right tool to use at that particular point. So when we talk about stress management, we talk about drug management techniques, techniques using drugs, and techniques using let's say behavioral or cognitive strategies. So with regards to stress management, we talk about problem-focused coping or problem-focused strategies or emotion-focused strategies. The easier ones are the emotion-focused strategies, which I'm sure most of you all are doing at the moment, and some of you all have actually found it helpful. We all have learned over the years with experience on how to manage stress. So sometimes, it might actually find a bit silly for me to sit here and advise people on how to manage stress. Because I think most of us are are healthy adults now, because we've kind of actually dealt with stress quite effectively. But for those of you who are finding it difficult to manage stress or don't actually know how to manage stress properly, I'll just run through some techniques you can use. A lot of people say that distraction is a very effective technique. So what people recommend is, you might have, let's say, you're at the workplace and your boss comes and kind of criticizes you. So you're having a really horrible time now. So one thing you can do is to distract yourself with something you like doing. Like probably go out of your office room and just go for a walk inside the office. Or probably go out of the office and just go for a stroll, or go take a friend with you and go out for lunch. Or maybe if you're somebody who likes listening to music and you have music on your phone, just put on the earbuds and listen to some music. Or if you can distract yourself by calling a friend, or just complaining to your spouse. So distraction with pleasurable activities can offer some comfort during that difficult time. We also talk about ventilation. This is emotional ventilation, where have you heard of the term, the less you open your heart to others, the more your heart suffers, something like that, where you talk about your difficulties or your difficult day with somebody else. So you can vent it out, and this is like a cathartic effect, where you can tell your spouse how horrible your boss is, or how unfair his remarks, or how he shouldn't have criticized you. And maybe you can experiment this for yourself, and immediately after talking about this, you might feel better, and that might be a bit of a stress relieving strategy. So talking to a good friend, a spouse, somebody who is willing to listen to you, will also help. Then we talk about deep breathing techniques. That is where we teach patients on progressive muscle relaxation or deep breathing techniques, which again you can do with just by yourself if you learn the correct technique. And you can go to YouTube, and there are lots of videos by different universities, where a therapist will actually show you on how to do these deep breathing or deep muscle relaxation techniques. And these are things that can be done anywhere, while you're traveling in the bus, or at the workplace, waiting in a waiting room, something like that. Mindfulness-based therapies, or mindfulness, has become now is very much in vogue, and is very fashionable. And this has actually shown to have a lot of benefit, not only as a short-term coping strategy, but also as a long-term coping. And it's now even used for the treatment of certain disorders like mild to moderate depression, where mindfulness-based therapies have found to be very effective. Again, this is not the type of meditation we do there is a religious basis to it, but a bit more than that, where we learn how to manage distress. There is distress tolerance, about keeping a mindful mind, not attaching yourself to a lot of negative emotions, negative thoughts, training your mind to be a non-sticky, like a Teflon mind, a non-sticky mind, things like that. So all those are what are called mindfulness techniques, which again you can learn by probably doing a mindfulness course, or reading about mindfulness. Then we talk about what we call problem-focused coping strategies. These are basically addressing the problem at hand. So one technique is called, or one therapy is called problem-solving therapy. This is something that is widely used, which therapists use a lot in patients people who are feeling very stressed. So problem-solving therapy is mainly recognizing the problems you're having, the issues that are causing stress, and then thinking about coming up with solutions for each problem. and then weighing the pros and coming up with different solutions for one problem, then weighing the pros and cons of each solution, and then choosing the best possible solution for that problem. So that's in a nutshell. But problem solving therapy is again a very effective and a commonly used technique in managing stress. Then the usual advice we get, like the usual advice we used to get from our parents: time management, use your time effectively, manage your time effectively, prioritize your tasks, things like that. Then getting yourself organized, probably organizing your day or organizing your week, so that you will be addressing all the issues that you have during that week, in order to reduce the stressors or reduce the stress level. One thing, Fatima, probably I really should mention or highlight here is that there is no harm or nothing is lost by asking for help. People are very reluctant to do that. It can be something very simple, like if you are having difficulty completing an assignment and let's say you're not very you're a bit technically challenged, then go to somebody who knows about computers or whatever and ask for help in that aspect. Or if you feel that you don't know how to do a certain task that was assigned to you, ask a colleague, or maybe just straight away ask your boss or tell your boss, I'm not very comfortable, or I haven't done this before. Can you just direct me, or can you advise me? So ask for help. I think a lot of us are very hesitant to do that, and I think by doing that, and we tend to postpone things we are not very familiar with, or we think we are not very good at, and by procrastinating that, the stress levels actually increase, because there is a deadline to meet and we are not meeting that deadline because we don't feel confident in doing that. But just by asking for help, that very simple task, that simple thing can actually bring down stress levels or curtail future stressful events. And also remember I told you about how to recognize stress. If you feel overwhelmed, or if you think that you've tried all these techniques and it's not helping, then it's probably time for you to meet a professional and then get professional advice on how to manage stress, and maybe whether you need some medication in the short term to deal with this stress. So with regards to getting help, another thing which we don't talk a lot about it in Sri Lanka, but especially in countries like the UK, in school, children are taught a lot about assertive communication, how to assert themselves, and how to ask for help assertively, and how to use it, and how to basically the importance of saying no to things which you think which you might not like doing, or you might not be good at, and saying no at the outset might sometimes be important in order for you to function properly. So in a nutshell, that is stress management. I hope you don't feel too stressed about listening to all these strategies, but these are basically the main strategies that are used in managing stress.
Thank you so much, because it does make sense. I'm certainly not stressed out. I'm enjoying listening to you, and I sincerely hope our listeners feel the same way, because it's something, with all due respect, it's not like rocket science. I mean, you can handle it, provided you have the correct approach.
Exactly.
But
yes,
then also,
I
think, Doctor, the thing is that you have explained to us how to approach it. That is what is important, because we don't know how to go about handling these stresses. And therefore, we can do something wrong to bring on more problems to the existing problems that we are facing. And having said that, so step by step, we do look at stress where we can overcome them by adopting the correct methods.
That's right, yes. So it depends on a cognitive style. So different people have different cognitive styles. Some people look at problems as a challenge, and they feel energized by it, and they will look at different ways, creative ways of solving that problem. some people are already defeated when they see a problem. So it's actually the way you look at a problem also. So maybe a change in attitude, a change, an active change in your cognitive style can probably again reduce stress in the long term.
In other words, you don't shy away from them, but you face them.
You face them, yes. Again, it depends on what your cognitive style has been for a long time. It's your personality trait, or it's your personality style. But definitely, we can always change the way we look at problems, and we can also always change our cognitive style. That is not something that is inbuilt. It is flexible. And if you're aware of what your cognitive style is, then you can probably take measures to change it, and then look at this as a challenge rather than a horrible experience I have to face with.
Thank you, Doctor. I think it's interesting, and on that note, a very positive note, we end yet another interesting discussion on how to know when we are stressed, how to deal with it, how to cope with it, how to overcome it. Step by step, as articulated by Dr. Suhashini Ratnatunga, consultant psychiatrist, National Hospital of Sri Lanka, and lecturer in psychiatry, Faculty of Medicine, University of Colombo. Thank you so much once again, Doctor, for being with us.
Thank you.
And taking us through this entire process. I would call it a free consultancy. These airwaves of Radio Sri Lanka. Thank you so much.
Thank you.
And we look forward to having you with us on the program in the foreseeable future. Thank you to Achala Gunasekar for technical assistance and Fatima Razi Khader. As always, saying good night at this point in time, and hoping to catch you next Monday same time on Views on Health.